It wasn't the deal they wanted, but the premiers have agreed to accept the healthcare funding offered by the Prime Minister last week. David Cochrane is in our Ottawa bureau tonight. And David, it sounds like the premiers are saying they'll take the money, but they'll keep negotiating.
Yeah, negotiating to a point and within the parameters laid out in the Prime Minister's offer on those bilateral arrangements that are being offered to the 13 provinces and territories on how the money that Justin Trudeau's put on the table can be used to deal with their specific needs in their specific systems. So that level of negotiation is still available to the premiers, but on the overall 10-year term of the agreement and the actual dollar amounts that were put on the table, Heather Stephenson told me today that they've pretty much accepted they're going to have to live with that.
We've accepted this for now, but we will move on to the bilateral agreements. But we do recognize that this is not a long-term solution to the healthcare funding that is needed within our country.
So not a long-term solution, because these agreements, this offer that the Prime Minister put on the table runs for a decade in. And what the premiers are now concerned about, they say, is what they call the fiscal cliff. What happens in year 11? Well, if you're the Prime Minister and you've gone from the premiers demanding $28 billion a year, offering them far less than that over the next decade, and the big concern they have today is what happens 11 years from now in terms of federal provincial funding arrangements, you're in a pretty good place politically. The premiers say they're going to keep publicly asking for more money. It's almost in the Constitution that they have to do that. That's the way this country works, it seems. But if the big concern is where are things in 2033, 2034, then this is a nice political victory for the federal government.
All right, David, thank you.
Thank you.